This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. Today we're going to talk about the latest on COVID and getting pregnant. I've come across a number of patients who have been reluctant to get vaccinated because they're trying to get pregnant. They've often been to their general practitioner, many of whom have been uncertain as to what advice should be given, and the patients have been told to come and see me. I don't quite understand this because the evidence is very clear, and I hope that general practitioners are giving the right information. And the right information is get vaccinated. There are now billions of doses of vaccine being given all over the world for women who have been trying to get pregnant, who were pregnant, who are in late pregnancy, who are in early pregnancy, and all the scientists who are looking to find things going wrong with vaccination have been unable to find anything that indicates that vaccination causes any problems in relation to fertility, to pregnancy, both from the mother or the baby's perspective. So, my advice, if you haven't got vaccinated and you're trying to get pregnant, is go and do it. Why am I so strong about this? Well, it's this, the facts. The facts are, and again, this is thousands of patients all over the world, probably hundreds of thousands. When you are pregnant and you happen to catch COVID, the complications are severe. An American study showed that there was a 15 times risk of ending up in intensive care compared with a pregnant patient who did not have COVID, and vaccination provides that protection. The stillbirth rate, that's losing a baby when you get to almost the day that the baby is due. A stillbirth is very uncommon, but it's twice as common if you catch COVID. In India, I was just reading a scientific report showing that miscarriage rates in women who catch COVID are 2 or 3 times more likely. I've seen multiple stories on the internet, news stories and Facebook stories, pregnant women dying because they caught COVID in pregnancy, because the immune system in pregnancy for a pregnant woman is suppressed. It's designed to help the baby grow. But because it's suppressed, it means that if you catch a virus, its symptoms are far worse. Even before COVID, if you caught the flu during pregnancy, you are much more likely to be affected, much more likely to have prolonged cough, aches, headaches than if you weren't pregnant. So the pregnant woman is so susceptible to severe disease if they catch COVID. Getting vaccinated helps protect you. The third group are women who we create artificial cycles altogether. And in these patients, we will be giving estrogen tablets to mimic what the ovary should be doing in that first 14 days of the cycle. And then we check the lining of the womb to make sure it's thick enough to undertake a transfer, because thickness of the lining is related to the chances of success. We like to see an endometrium more than 7 millimeters in thickness before we would be keen to put back an embryo. Once the lining has got to that thickness, then we can start the progesterone. Because the ovary is not producing any of the progesterone, all of it is coming from the tablets, gels or pessaries that we're going to give you. The timing for that embryo transfer, once you've started the progesterone, is 5 days. So 5 days of progesterone brings the lining in the womb into synchrony with the stage of development of the embryo, and that will then result in optimal implantation. The progesterone will be continued together with the estrogen even when you're pregnant all the way through to 10 or 12 weeks. By then, the pregnancy itself, from the placenta, the hormones, progesterone and estrogen, are produced from that, and they sustain the pregnancy independent of the woman's ovaries. So the luteal phase is a vital part of natural conception and obviously of conception through ART. We've learnt a lot about improving the lining of the womb in that second half of the cycle. We now have multiple medications that assist in that process, but if you've got any concerns, then talk to your specialist and hopefully help you get a good pregnancy. And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.